Assalamualaikum. My name is Minat Tanveer. My roll number is BP 165137 and I'm a student of Final Puff Morning. And the drug I was given was Diathranol. So here we begin with the presentation. The topics I'm going to cover are first the introduction of the drug, then the rational use of it, what will be the contraindications, side effects, dosage forms in which the drug is available, and then the toxicity of the drug, its irrational use in some places, its drug-drug interaction, antidote, alternative brands, alternative choices, and case study in the end. Now heading towards our first topic, that is introduction. Diathranol is basically an anthralin drug, which is a synthetic anthracene derivative, and it has anti-proliferative and anti-inflammatory effects on the skin. That is why the indication in the rational use in which the drug is being used is the treatment of long-term psoriasis. Usually when a patient is suffering from a long-term psoriasis and or the plaque psoriasis, then we recommend Diathranol creams and ointments. It is generally used for the short contact treatment and washed off after a defined period. Now its contraindications, that generally the Diathranol is not recommended when the skin is inflamed or irritated, and when the condition for psoriasis is acute and there is an eruption in psoriasis. So we generally don't recommend Diathranol in those conditions. Then the side effects of the drug. The side effects are inflammation. It can cause inflammation, irritation of the skin, and also it can lead to the contact dermatitis, and it also stains the skin and the clothes and can cause localized burning, but very rarely. Okay, now the dosage forms in which the Diathranol is available. It is generally applied topically and not involved systematically. So the dosage forms available are cream, ointment, lotion, shampoo, which are generally applied topically and or on the skin. The toxicity of the drug is there are mild adverse effects, like we have discussed in the side effects. So there are some mild adverse effects like staining of the skin, and it can also cause the irritation of the skin. However, there are some long-term studies which have shown that mice can have the tumorogenic effects. It can develop tumors in the mice, but it is not still found in the human beings. Now its irrational use. Generally, the Diathranol ointment is used irrationally, or we can say that it is misused in some conditions, like cutaneous dermatophyte infection, Tyriasis versicolor, and Tyriasis alba, melasma. These are the skin conditions in which it is misused. However, it is only recommended in the psoriasis and for the short-term treatments. Now the drug-drug interaction, no such drug-drug interaction has been seen in yet and reported, and the antidote, no antidote is there because the drug is not involved systematically and applied only topically. That is why no overdosing and antidote has been reported. Now if we move towards the alternative brands, there are two brands of Diathranol which are found in Pakistan. First one is Anazerile, which is in the form of ointment, and obviously it is applied topically, and the price is 321.55 paisa. The other brand is Diathroderm, which is a cream topically applied, and there are different concentrations of Diathroderm available. That is why there are different prices for it. Diathroderm is usually available in 0.5% weight by weight, and 0.1% weight by weight, and 0.25% weight by weight, and only Diathroderm is available in the Diathranol form. However, Anazerile is a mixture actually with salicylic acid, diathranol, resorcinol, and ecothamol, which is an ointment and applied topically. That is why it is a little bit has more price than diathroderm, and we can recommend diathroderm and anazerile both depending on what patient requires. If if there is no such roughness and dryness on their skin, then we can recommend the diathroderm. However, in anazerile, the diathranol is mixed with the salicylic acid and some other agents too, which helps in smoothing of the skin and removes the scale which are caused due to the plaque psoriasis. So depending upon the condition, we can recommend either of these brands. Now the alternative choices, we have coal tar, some topical corticosteroids, and topical calcipotriol. These are all topically applied medications, as psoriasis is caused on the skin. So when we initiate a treatment, we start with the topically medications. There are some systematic medications too, but these are rarely used, or they are generally used when the condition is very severe, and along with the along with the topical medications, systematic medications are also given for psoriasis in severe conditions or in elderly patients. Coal tar is one of the oldest treatment we use for psoriasis, and it has anti-inflammatory, antibacterial, antipruritic, and antimitotic effects. But there are some adverse effects, like it can cause local irritation and staining of the cloth and skin, and there is foul odor. That is why it has some limited usage, and it is also given along with diathranol in some cases. It depends what the pharmacist and the doctor recommends as per their experiences. And then there is topical corticosteroid. Generally when a patient comes with their psoriasis, uh, the topical corticosteroids are the first line treatments we use and recommend, because of their quick onset of actions. So the topical corticosteroids are more recommended than diathranol. They have anti-inflammatory effect, and they are used for mild to moderate conditions, and they are available in different strengths. So we can apply different topical corticosteroids according to the condition and the severity of the psoriasis, and it can be used once or twice daily, and has been seen really effective for the stable plaque psoriasis. Now there is another choice we can use, that is topical calcipotriol. It is a vitamin D analog. It can be applied once or twice daily, and it is also an effective treatment for mild localized psoriasis, and it is generally used in the primary care settings. The one adverse effect associated with calcipotriol is the hypercalcemia. So it is also limited, but it is still an efficient and more it has more efficacy than the diathranol. So if in case of diathranol, if we instead of diathranol, we can recommend topical corticosteroids and topical calcipotriol more, as they are more efficient and has more efficacy. Now moving towards our last topic, that is case study. The case study is a 24-year-old man presents at the clinic with a 10-year history of plaque psoriasis affecting his elbows, knees, and sacral area, with a few small plaques elsewhere. He is otherwise fit and well. He regularly plays football and is embarrassed by the appearance of his skin. He has tried Betnovit RD ointment 0.025%, which smoothed the plaques a little, and calcipotriol ointment, which removed the scale from the plaques but did not clear them. Okay, if we move towards the soap notes, the first one is the subjective. The name of the patient was not given, so we can write ABC or anything. Now the age was 24 years, gender male. Current complaint is there is no such current complaint, but the patient is actually embarrassed due to the appearance of his skin. So that is why he visits and says that his plaques are still visible and wants it to clearly remove them from his skin. So that is why he comes to the hospital or to whomever he goes. The history of the illness is that plaque psoriasis has been shown on knees, elbows, in the sacral region, and it is from 10 years to him. And the current medications he was using was Betnovit RD ointment 0.025%, uh, which is a corticosteroid, and it is a first line treatment which was recommended to him to reduce the inflammation and the redness of his skin and to smooth his plaques. And the calcipotriol ointment was very good in case of uh, removing his scales of the plaque psoriasis. And the social interaction, if we see that he is a footballer, but he is a little embarrassed because his skin is exposed to the people, so he is a little embarrassed because of the appearance of his skin due to the psoriasis and his scaly skin. So he doesn't interact that much, but he is a footballer and goes and socialize a little. Now there is a second part which is objective. The lab data was not available, but the health condition described in the question was well, and he was healthy and fit as he plays football. And now the assessment, we can see that there is no such severity still, and plaques are present on different areas of the skin other than knees, elbows, but they are localized, and those are mild to moderate. So and not scaly and dry, because Betnovit RD ointment and calcipotriol was effective, but he wants all the scars on the skin to be removed. So we can recommend in the plan that we can recommend Diathranol for the short contact. Um, so the as because he is already stable, so his scars and the patches on the skin which are shown or which can be seen can be cleared out, and the calcipotriol ointment can be continued along with it to help to remove his scales on the skins. And patients should also be counseled about the potential future systemic medications, as the psoriasis can also be severe as he grows older. So there are some references which were Clinical Pharmacy and Therapeutics, the book from which I have taken the case and some of the contents, and there are some websites. And that was all for my presentation. Thank you.